Us when we're sick or injured, and especially during this pandemic, nurses have gone above and beyond. But just as we need them the most, the on-again, off-again nursing shortage is on again, and it's not slowing down anytime soon. ABC Action News anchor Lauren St. Germain is going in depth tonight on how we got here, the toll the shortage is taking on nurses in the Bay Area, and the movement to get more people into the profession.
We wanted to do this report after learning about changes coming right here to the USF College of Nursing. They're essentially ending one program to put more resources into another program. They tell us it's to get more nurses into the pipeline, into the hospitals right here in Tampa Bay. So our question was, what is it like for these nurses right now? Because the demand is not slowing down. In fact, the U.S. Bureau of Labor Statistics projects the U.S. will need another 1.1 million nurses by 2022. So we went to the very people working through this shortage to help us better understand what it's like. Sheila Castle has been a nurse for more than 25 years. Right now, she works at Johns Hopkins All Children's in St. Pete.
Considering that I was told about the nursing shortage while I was in nursing school,
which was back in the 90s.
It's ironic that it's coming back up, and now I am feeling the results of this nursing shortage.
Castle tells me what she is seeing among colleagues.
So we have the retirement, we have early retirement, and then some just decide to leave nursing altogether and change fields and go into a different career path.
This matches information from the American Association of Colleges of Nursing. It says a large percentage of the current workforce is nearing retirement age, and nursing school enrollment is not growing fast enough. There's also a shortage of people to teach future nurses.
It's putting a lot of stress on those that are still working to train the new generation of nurses that are coming up.
We also wanted to get the perspective of that new generation.
For as long as I can remember, nursing was exactly what I wanted to do.
Kayla McNulty has been working as a pediatric registered nurse at Johns Hopkins All Children's for a couple of years.
It's definitely been tough, especially I've only been a nurse for almost 3 years. So the past year and a half, it's been really, really hard.
McNulty says they take it shift by shift and rely on each other.
None of us really want to leave. We just kind of want to get through it. But it's been a long period of just knowing we need 9 nurses tonight, but we're working with 7, and just what that's going to look like for the 12-hour shift, and what now that shift is turning into weeks, and now it's been months.
The nursing shortage varies by state. We spoke with the dean of the USF College of Nursing about what's happening in Florida.
In the next year, by 2022, the estimate is that the U.S. will need another 1.1 million nurses. And in Florida, the shortage is escalating, where estimates show by 2025, we are really going to be in very great trouble.
The dean tells me right now the biggest problem nurses are facing is burnout, especially those who have worked through the pandemic. She tells me right now they're really focusing on helping the nurses with self-care. It's something they didn't necessarily focus on before. And both nurses I spoke with tell me they see it and they feel it.
I've just kind of realized that self-care is so important.
My advice to those out there, recognize it. It was a long time before I actually recognized that I was having some burnout, and before I started doing some things to help counteract that.
And it makes all the difference just to kind of step back, reassess, kind of realize why you're doing what you're doing.
Despite all the challenges, both McNulty and Castle remain optimistic.
But now more than ever, we have the chance to show people our strength, our resiliency through this crazy time, and ultimately our commitment to our patients and their families.
Because that's what nurses do. You're here for a reason, a main purpose, to provide care and comfort to those that come through your doors.
And Dean Menon with a message for nurses who are really struggling right now.
Well, one is to hang in there. You know, it has been a very, very tough year for all of us. The rewards are enormous. Maybe take a break, but don't leave the profession entirely, because we need you.
We need the healthcare professionals, and we need the nurses because we are getting older. A University of Florida study published last year projects 38% of people in the Bay Area will be 55 and older by the year 2030. You can listen to the full interview with the Dean of the College of Nursing on our website, abcactionnews.com. She really breaks down how this program is shifting to get more nurses into Tampa Bay hospitals. We're also breaking down what incentives hospitals are offering offering new nurses and current employees to get more nurses into their hospital. Again, that's on our website, abcactionnews.com. At USF, I'm Lauren St. Germain, ABC Action News.